Hello and welcome to Focus 54, your weekly guide into real African stories. I am your host, Jabulani Tulani Kumalo, and on this week's episode, we are looking into the annual International Conference of Public Health in Africa that just ended on Thursday. This conference provides a unique African lead platform for leaders across the continent to reflect on lessons learned in the health science, aligning on a way forward for creating more resilient health systems. This year's conference runs under the theme Breaking Barriers, Repositioning Africa in the Global Health Architect. But firstly, let's take a look at these stories that are making headlines across the continent. We kickstart with Mozambique as it unveils its ambitious 8 billion groundbreaking energy transition plan set to Spain until 2050, with the goal of securing investments totaling approximately 80 billion. The comprehensive strategy aims to propel the nation towards a more sustainable future for enhancing renewable energy capabilities and ensuring wider energy availability. We move on to South Africa as hundreds of people join a pro-Palestinian march in Johannesburg on Wednesday. Members of the public, political parties, civil servants, organizations and other supporters marched through the streets of Johannesburg demanding a permanent ceasefire in Gaza as they marked the International Day of Solidarity with the Palestinian people. And we move on to Cameroon as the country is set to administer malaria vaccine in 2024. This comes after the United Nations had held on Wednesday the forthcoming scale of malaria vaccine across Africa after the first shipment of doses arrived in Cameroon. Since 2019, more than 2 million children have been jabbed in Ghana, Kenya, Malawi in a pilot phase, resulting in sustainable reduction in severe malaria illnesses and hospitalization. Now the scheme is moving into a border rollout. This is all we had for you in the segment. Please join us in the next segment as we go deeper into the topic of today. Welcome back to the second segment of Focus 54. Now I'm joined by health experts Ratlo Tamatorwa and Atafazwa Jawara, and in the studio with me right now. And I am pleased to welcome you to the show.
Thank you so much.
Thank you so much.
Thank you. So maybe I'll start with the first question with you, Mr. Matorwa. What is the significance of the conference that was held in Lusaka, which is the Conference of Public Health in Africa?
Okay, thank you for that question. I think I have to start with maybe making the viewers know what this conference is all about.
True.
Conference of Public Health in Africa is a gathering of public health experts across Africa where these experts meet annually to share and deliberate on the state of public health in Africa. One of the key objectives of that conference is to share information and also come up with the best practices that can take the agenda of public health ahead. You would understand that Africa is actually in a situation where we are confronted with many issues that affect public health currently.
Yeah,
so this is the platform where the who's and who in the public health fraternity meet to discuss how to take the public health agenda forward.
Okay, thank you very much. And what are the primary health infrastructure challenges in Africa that hinder the continent's ability to compete global in a field of public health?
Okay. I think there are many issues that are currently affecting Africa, but I would want to issue a disclaimer that whilst there are many issues affecting Africa, one of the things that I'm excited about is that Africans have really taken a position in terms of saying that they must confront their own problems. We can see this initiative of Conference of Public Health in Africa is one such positive initiative where we are saying we have a role to play when it comes to addressing our infrastructural challenges. At present, we are facing infrastructural challenges that ranges to issues to do with access to healthy facilities, for example. They are not widely within the 5-kilometer range that has been pegged by WHO. You understand that we also have an issue with specialized services. You can go to primary health care facility and it's very difficult for you to get a CR scan or just an ordinary scan or some radiology services. You can't get there. Nutritionists may also not be within the vicinity, for example, to advise mothers on how to feed children, for example. True. So we are having a lot of issues that are affecting our access to health. When you also talk about issues to do with facilities that promote health and well-being of the citizens, also look at issues to do with access in terms of skills. Because you can have an infrastructure, but if that infrastructure is not supported by adequate skills, you actually have a problem there. So you go to a hospital where you find that one doctor is serving, maybe in an example of district of Cholocho, for example, that one doctor is serving 8 hospitals, which is very difficult for that person. Our road network itself, they're also a cause of concern when it comes to access to health care. We are also talking about our testing capacity itself. Do we have enough testing infrastructure? I'm sure you are aware that there are diseases that need confirmations of laboratory tests. How accessible are these laboratory tests? So we need to do a lot of evaluation of our public health infrastructure and fill in the gaps in order to enhance access to health in this country or in Africa per se.
Right, true. But any progress on any of the mentionables that you mentioned, for example, for the doctors, we have a situation of doctors whereby we don't have skilled doctors. You mentioned it, right? Are there any form of movement, anything, any improvement into that, anything that has been implemented to hinder that? I would take it to you, ma'am.
Yes, definitely. The Ministry of Health and Child Care and all the public health players in the country have been doing quite a lot. Took off the initiative of the that is ongoing. I understand a few districts are already running on what we call the community health strategy, which is trying to address the issue of proximity to your healthcare facility. So they want to try and do what we call the health posts, so that health is accessible to people within their village, not just within their ward. And also, you talked about skills. We would want to acknowledge the cadres that are on the ground when we talk about primary health care, who are called the village health workers, which is why, as Public Health Association of Zimbabwe, we feel that they have a special place because they are actually playing a very important role, especially in outbreaks, you know, the just ended or the ongoing pandemic of COVID-19, malaria. They're the first people that are to attend the patients before any help has gotten to them, and they have managed to save a lot of lives. Then there is also the outreaches that are ongoing. I understand Ministry of Health is the parent ministry that has been holding that, and it's an incredible effort that they've been making, because what happens is at the outreach is all these skills are put together. These people, they come in together, the nurses, the doctors, the nutritionists, everyone who is important is part of that team, and they go to those hard to reach communities to offer health services nearer to them. So I would like to applaud the efforts that have been happening, especially these issues to do with the outreaches, the health posts, and of course these issues of public health now encompassing not just the medical fraternity, but all people that are essential to public health, including even yourselves as journalists, you know.
Yes,
so
sure.
that's